we're focusing on the delicate skin around your eyes, an area that deserves special attention and gentle care. The skin around your eyes is different from the skin on the rest of your face. It's thinner, more delicate, and has fewer oil glands. This makes it more vulnerable to dryness, more prone to showing signs of aging, and more sensitive to harsh ingredients or rough treatment. Because of these unique characteristics, the eye area often benefits from dedicated care beyond your regular face routine. Let's understand common concerns around the eyes and what causes them. Dark circles under your eyes can have multiple causes. Genetics play a significant role. Some people simply have thinner skin or more visible blood vessels in this area, creating a darker appearance. Lack of sleep causes blood vessels to dilate, making dark circles more prominent. Allergies lead to inflammation and blood vessel dilation. Aging causes fat and collagen loss, making the area appear more hollowed and shadowed. Sun damage can increase pigmentation in this delicate area. Puffiness or under-eye bags result from fluid accumulation. This can happen overnight as fluids settle when you're lying down. Allergies cause inflammation and swelling. Too much salt in your diet can lead to water retention. Aging causes fat pads under the eyes to shift and create a puffy appearance. Lack of sleep affects fluid balance throughout your body, including around your eyes. Fine lines and wrinkles appear first around the eyes because this skin is thin and moves constantly with every smile, squint, and facial expression. Sun damage accelerates their formation. Natural collagen loss with aging makes them more pronounced. Dehydration makes them more visible. Understanding these causes helps you address them appropriately rather than expecting one miracle cream to fix everything. Now let's talk about eye creams and whether you actually need one. The truth is, not everyone absolutely needs a separate eye cream. If you're young, your skin is generally resilient, and you're not experiencing specific eye area concerns, your regular moisturizer might be perfectly adequate. Many facial moisturizers are gentle enough to use around the eyes. However, a dedicated eye cream makes sense if you have specific concerns like dark circles, puffiness, or fine lines. If your regular moisturizer is too rich or contains actives that might irritate the delicate eye area, if you want ingredients specifically targeted to eye concerns, or if you simply enjoy the extra step of caring for this area specifically. The choice is yours based on your skin's needs and your preferences. There's no universal rule that everyone must use eye cream. Let's discuss what to look for in an eye cream based on specific concerns. For dark circles, look for caffeine, which constricts blood vessels and can reduce the appearance of darkness caused by visible vessels. Vitamin K supports healthy circulation and can help with vascular dark circles. Niacinamide brightens and can help with pigmentation-based darkness. Vitamin C also brightens and protects against further pigmentation. Keep expectations realistic. Eye creams can help somewhat with dark circles, but they can't completely eliminate them, especially if they're genetic. For puffiness, caffeine is again helpful as it constricts blood vessels and can help reduce fluid accumulation. Peptides support skin firmness. Cooling application helps. Keep your eye cream in the refrigerator for an extra depuffing effect. Gentle massage during application can encourage lymphatic drainage and reduce puffiness. For fine lines and wrinkles, retinol is effective for increasing collagen production and smoothing texture, but use gentle eye-specific formulations as this area is sensitive. Peptides signal skin to produce more collagen and support firmness. Hyaluronic acid plumps skin and makes lines less visible through hydration. Ceramides strengthen the skin barrier and improve moisture retention. Antioxidants like vitamin C and vitamin E protect against further damage. For general hydration, hyaluronic acid is excellent as it holds up to 1,000 times its weight in water. Glycerin is a simple, effective humectant. Squalane provides lightweight moisture. Ceramides support barrier function. Now let's discuss how to apply eye cream properly because technique matters with such delicate skin. Use your ring finger for application. It naturally applies the gentlest pressure. Your ring finger is weaker than your index or middle finger, which helps prevent tugging at delicate skin. Apply eye cream to clean skin, typically after serums but before your face moisturizer, though order can vary based on product consistency. Take a small amount, about the size of a grain of rice per eye. Eye creams are concentrated, and a little goes a long way. Using too much won't provide additional benefits and can actually cause milia, small white bumps that form when product clogs pores. Dot the eye cream along your orbital bone, the bony area that surrounds your eye socket. Place dots under your eye from inner to outer corner, along the outer corner, and on your upper lid if the product is suitable for that area. Gently pat the product into your skin using your ring finger. Don't rub or pull. Pat, 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 moving from inner corner outward and upward. This gentle patting motion helps with absorption without traumatizing the skin. Avoid getting product directly on your eyelid margin or too close to your lash line. Product can migrate into your eyes, causing irritation. Stay on the orbital bone area. Apply eye cream morning and night, or just at night if you prefer. Consistency matters more than frequency. Some people enjoy using an eye serum underneath their eye cream for extra treatment benefits. If you do this, apply the serum first, let it absorb, then apply your eye cream to seal it in. Let's talk about what to avoid in the eye area. Never pull, tug, or rub the skin around your eyes roughly. This delicate skin doesn't bounce back well from trauma. Always use gentle patting or pressing motions. Be cautious with harsh active ingredients. While retinol can be beneficial for the eye area, use formulations specifically designed for this sensitive region, or use your facial retinol very carefully, avoiding the immediate eye area. Avoid getting facial products with strong actives directly in the eye area unless they're specifically labeled as eye safe. AHAs, BHAs, and strong vitamin C formulations might be too irritating for this delicate skin. Fragrance and essential oils are common irritants. In eye products especially, fragrance-free is often safer. Be careful with sunscreen around the eyes. Some sunscreens sting if they get into eyes. Look for mineral sunscreens or those labeled as suitable for the eye area. Wearing sunglasses provides extra protection. Now let's discuss additional ways to care for your eye area beyond just product application. Sun protection is crucial. The skin around your eyes is vulnerable to sun damage. Wear sunscreen daily, carefully applied to avoid eyes, and wear UV protective sunglasses when outdoors. Sunglasses also help prevent squinting, which contributes to wrinkle formation. Stay hydrated. Dehydration makes fine lines more visible and can worsen dark circles. Drink adequate water throughout the day. Get sufficient sleep. 7 to 9 hours allows your body to repair and reduces puffiness and dark circles. Elevating your head slightly while sleeping can help prevent fluid accumulation that leads to morning puffiness. Manage allergies. If allergies cause your under-eye puffiness or darkness, address the underlying allergy with appropriate treatment. Use a humidifier if you live in a dry climate or heat your home in winter. Dry air worsens dehydration around the eyes. Remove eye makeup gently. Use a gentle oil-based remover or micellar water specifically for eyes. Soak a cotton pad, hold it against your closed eye for a few seconds to dissolve makeup, then gently wipe away. Don't tug or scrub. Limit salt intake if you're prone to puffiness. Excess sodium causes water retention that can manifest as puffy eyes. Cold compresses can temporarily reduce puffiness. Chilled cucumber slices, cold tea bags, or specialized eye masks kept in the refrigerator provide soothing relief. Let's address some eye area myths. Myth: hemorrhoid cream is good for under-eye puffiness. Truth: while hemorrhoid cream contains vasoconstrictors that might temporarily reduce puffiness, it's not formulated for facial skin and can cause irritation. Use products designed for the eye area. Myth: eye cream must be expensive to work. Truth: effective eye creams exist at various price points. Good ingredients matter more than price tags. Myth: you should start using eye cream at age 25. Truth: there's no magic age. Start when you have concerns you want to address or when you want to begin preventive care. Some people start in their 20s, others in their 30s or 40s. It's personal. Myth: patting cream in upward motions prevents wrinkles. Truth: gentle application prevents trauma to delicate skin, but the direction doesn't prevent wrinkles. Wrinkles form from sun damage, natural aging, and repeated expressions, not from which direction you apply cream. Let's discuss realistic expectations for eye products. Eye creams can hydrate, can reduce the appearance of fine lines through hydration and barrier support, might help somewhat. Welcome, and thank you for taking this time for yourself today. Before we begin, let's take 3 slow, calming breaths together. Breathe in deeply through your nose, hold for a moment, and exhale gently through your mouth. Again, breathe in, feeling your shoulders relax, and breathe out, releasing any tension. One more time, breathing in peace and breathing out stress. Beautiful. Now let's talk about something that affects so many of us: hormonal acne. Hormonal acne is one of the most frustrating skin concerns because it can feel unpredictable and overwhelming. Unlike other types of acne, hormonal breakouts often appear in specific patterns and at specific times, making them easier to identify once you understand what to look for. Today, we're going to explore how hormones affect your skin, what makes hormonal acne different, and most importantly, how to care for your skin through these hormonal fluctuations with gentleness and patience. Let's start by understanding what hormonal acne actually is. Your skin has tiny receptors that respond to hormones circulating in your body. When certain hormones fluctuate, particularly androgens like testosterone, your skin's oil glands can become more active. This increased oil production, combined with changes in how skin cells are shed, creates the perfect environment for clogged pores and inflammation. Hormonal acne typically appears along your jawline, chin, and lower cheeks, though it can also show up on your neck and back. What makes hormonal acne different from other types is its timing and pattern. You might notice that breakouts appear like clockwork before your menstrual period, or they might worsen during times of stress or hormonal transition. These breakouts tend to be deeper, more painful, and longer lasting than surface-level pimples. They often appear as cysts or nodules under the skin, rather than whiteheads or blackheads on the surface. Understanding this pattern is the first step in managing hormonal acne effectively. Now, let's talk about the hormonal cycles that affect your skin. During your menstrual cycle, hormone levels rise and fall in a predictable pattern. In the first half of your cycle, estrogen levels are higher, which generally has a positive effect on skin. Estrogen helps keep oil production balanced and supports collagen production. However, in the second half of your cycle, progesterone levels rise and testosterone becomes more dominant. This shift stimulates your oil glands to produce more sebum, setting the stage for breakouts. Stress hormones also play a significant role in hormonal acne. When you're stressed, your body produces cortisol, which can trigger increased oil production and inflammation. Chronic stress can keep cortisol levels elevated, creating a cycle where your skin never gets a chance to calm down. This is why you might notice that your skin breaks out more during stressful periods at work or in your personal life. Managing stress isn't just good for your overall well-being, it's an essential part of caring for hormonal acne. Major hormonal transitions also affect your skin in profound ways. Pregnancy brings dramatic hormonal changes that can either improve or worsen acne. Some women find their skin clears beautifully during pregnancy, while others experience breakouts they never had before. Postpartum is another time of significant hormonal shift as your body adjusts to no longer being pregnant and possibly to breastfeeding. Perimenopause and menopause bring their own changes as estrogen levels decline and the ratio of androgens to estrogen shifts, often triggering breakouts in women who never struggled with acne before. Let's discuss how to care for skin with hormonal acne. The foundation is always gentle cleansing. Use a mild pH balance cleanser twice daily to remove excess oil without stripping your skin. Avoid harsh scrubs or cleansers that leave your skin feeling tight and squeaky clean. That strip feeling tells you that your cleanser is too harsh, which can actually trigger more oil production as your skin tries to compensate. Look for cleansers with calming ingredients like chamomile or green tea that won't inflame already sensitive skin. Salicylic acid is particularly helpful for hormonal acne because it can penetrate into pores to dissolve the oil and dead skin cells that cause clogs. Start with a product containing 1 to 2% salicylic acid, using it once daily to see how your skin responds. You might use it as a cleanser, toner, or leave-on treatment. The key is consistency and patience. Salicylic acid works over time, not overnight, so give it at least 6 to 8 weeks before deciding if it's helping. Niacinamide is another excellent ingredient for hormonal acne. This form of vitamin B3 helps regulate oil production, reduces inflammation, and supports your skin's barrier function. It's generally well tolerated even by sensitive skin and can be used both morning and evening. Look for serums with 5 to 10% niacinamide, applying them after cleansing and before moisturizing. Niacinamide works beautifully with other acne-fighting ingredients, making it easy to incorporate into your routine. Retinoids deserve special mention when discussing hormonal acne. These vitamin A derivatives help regulate skin cell turnover, preventing the buildup of dead cells that contribute to clogged pores. They also help reduce inflammation and can improve the appearance of acne scars over time. If you're new to retinoids, start with an over-the-counter retinol product 2 or 3 times per week. gradually increasing frequency as your skin builds tolerance. Apply retinol at night to clean, dry skin, followed by your regular moisturizer. Moisturizing is absolutely essential, even for oily, acne-prone skin. When you skip moisturizer, your skin can become dehydrated, triggering even more oil production. Choose oil-free, non-comedogenic moisturizers that hydrate without clogging pores. Gel-based or lightweight lotion formulas work well for most people with hormonal acne. Ingredients like hyaluronic acid provide hydration without heaviness, while ceramides support your skin's protective barrier. Sun protection is non-negotiable when treating acne. Many acne treatments, particularly retinoids and acids, make your skin more sensitive to sun damage. Use a broad-spectrum sunscreen with at least SPF 30 every morning, even on cloudy days. Mineral sunscreens with zinc oxide or titanium dioxide can be particularly good for acne-prone skin because these ingredients also have anti-inflammatory properties. If you find traditional sunscreens too heavy, try gel-based or fluid formulas designed for oily skin. Spot treatments can help with active breakouts, but use them carefully. Benzoyl peroxide is effective at killing acne-causing bacteria and reducing inflammation. Start with a 2.5 or 5% formula, applying it directly to blemishes rather than your entire face. Be aware that benzoyl peroxide can bleach fabrics, so let it absorb completely before touching towels or pillowcases. Tea tree oil is a natural alternative with antibacterial properties, though it should always be diluted before applying to skin. Now let's talk about what to avoid. Resist the urge to pick or squeeze your blemishes. Hormonal acne cysts are deep in the skin, and squeezing them only pushes bacteria deeper, increases inflammation, and raises the risk of scarring. If you have a particularly painful or persistent cyst, see a dermatologist who can safely inject it with medication to reduce inflammation quickly. Trying to extract it yourself will only make it worse and last longer. Be cautious with thick, occlusive products on acne-prone areas. While face oils and heavy creams might be lovely for dry skin, welcome and take a moment to arrive fully here. Breathe in slowly and deeply, then exhale with a gentle release. Let yourself be present and relaxed. Today, we're going to explore how to build a gentle weekly skincare plan, a sustainable, organized approach that supports your skin without overwhelming it or you. A weekly skincare plan brings structure and intention to your routine. It helps you maintain consistency with your basics while creating space for treatments and special care when appropriate. It prevents over-treatment while ensuring you're doing enough. Think of it as a gentle rhythm for your skin, a predictable pattern that allows your skin to thrive. The beauty of a weekly plan is that it removes daily decision-making. You know what you're doing each day. You're not constantly wondering if you should use a treatment tonight or if you're doing too much or too little. The plan becomes your guide, and following it becomes automatic. Let's begin by establishing the foundation, your daily non-negotiables that form the backbone of every single day, regardless of what else you might do. Every morning, without exception, you need 3 essential steps: cleansing or rinsing, moisturizing, and sun protection. These 3 steps maintain your skin's health and protect it from the primary external cause of damage, UV radiation. No matter what else varies in your weekly plan, these morning basics remain constant. Every evening, you need gentle cleansing to remove the day's accumulation, followed by moisturizer to support your skin's overnight repair. These evening basics are also constant, creating a reliable foundation your skin can count on. So your basic daily rhythm looks like this. Morning, cleanse or rinse, moisturize, apply sunscreen. Evening, cleanse thoroughly, moisturize. This is your foundation. Simple, consistent, sustainable. Everything else in your weekly plan builds upon this foundation without replacing it. Now let's discuss how to incorporate treatments and additional care into your weekly rhythm without overwhelming your skin. If you're using active treatments, retinoids, vitamin C, acids, or other potent ingredients, you'll schedule these intentionally rather than using them randomly or daily. Most people don't need daily use of actives, and many skins can't tolerate it. Strategic, spaced-out use often works better. Let's build a sample, gentle weekly plan together, and then you can adapt it to your specific needs. Monday through Sunday, your foundation routine every single day, morning and evening, as described above. Now we add treatments thoughtfully. Let's say you want to use a retinoid for anti-aging and cell turnover, and a gentle acid treatment for texture and brightness. Here's how you might schedule these. Monday evening, basic routine only, no treatments. Tuesday evening, basic routine only, no treatments. Wednesday evening, apply retinoid after cleansing, before moisturizer. Use your regular moisturizer on top. Thursday evening, basic routine only, no treatments. This rest day allows your skin to recover from the retinoid. Friday evening, basic routine only, no treatments. Saturday evening, apply acid treatment after cleansing, then moisturizer. Or do a gentle enzyme mask for 10 to 15 minutes before your regular routine. Sunday evening, basic routine only, no treatments. Notice the pattern. Treatments are separated by several days, never used consecutively. Your skin gets ample recovery time between active treatments. Most of your week is simply gentle basics, which is exactly what your skin needs. If you're just beginning to use actives, start with less frequency. Perhaps retinoid only once per week for the first month, then gradually increase to twice weekly if your skin tolerates it well. Patience prevents irritation and allows your skin to build tolerance. Let's consider another example. Someone dealing with oily, acne-prone skin who wants to use salicylic acid and niacinamide. Daily foundation routine. Gentle gel cleanser. Morning and evening. Lightweight oil-free moisturizer. Sunscreen in the morning. Monday evening. Salicylic acid treatment after cleansing, then moisturizer. Tuesday through Thursday evenings. Basic routine only. Friday evening, salicylic acid treatment after cleansing, then moisturizer. Saturday and Sunday evenings, basic routine only. The niacinamide could be in their daily moisturizer or serum, used every day as it's gentle and well tolerated. The salicylic acid, being more active, is used only twice weekly with several days between applications. For someone with dry, sensitive skin focusing on barrier repair and hydration, daily foundation routine, cream cleanser, evening only, water rinse in morning, rich moisturizer with ceramides, gentle mineral sunscreen, every evening. After cleansing, layer a hydrating toner, then a barrier repair serum, then moisturizer, topped with a facial oil. Sunday evening, add a hydrating sheet mask or cream mask before your regular routine, or simply do an extra generous application of moisturizer and facial massage for 5 to 10 minutes. Notice that this routine has no actives, just layers of hydration and barrier support. The weekly variation is minimal, with Sunday as a day for extra pampering and hydration. This simplicity is perfect for sensitive skin that needs gentleness above all. Let's talk about incorporating masks, treatments, and special care into your weekly rhythm. Many people enjoy using masks as a weekly ritual. This is lovely if you enjoy it, but remember that masks are optional, not essential. If you use them, choose masks appropriate for your skin's needs and schedule them strategically. Hydrating masks can be used more frequently, even several times per week, as they're gentle and nourishing. These are perfect for any evening when your skin feels particularly dry or tired. Clay or purifying masks for oily or congested skin should be used less frequently, perhaps once weekly or every other week, as they can be drying. Always follow with good moisturization. Exfoliating masks, whether physical or chemical, count as active treatments and should be scheduled carefully, ensuring you're not over-exfoliating. Sheet masks are typically hydrating and gentle, making them suitable for weekly use or whenever your skin needs a boost. Consider designating one evening per week as your spa night, perhaps Sunday, when you have extra time for masks, extended facial massage, or simply a more luxurious, mindful version of your regular routine. This creates something to look forward to and turns skincare into self-care ritual rather than mere maintenance. Let's discuss morning variations in your weekly plan. Most people benefit from keeping mornings simple and consistent. The basic cleanse or rinse, moisturize, and sunscreen routine is usually sufficient. However, you might incorporate a vitamin C serum in your morning routine if you choose. Vitamin C provides antioxidant protection and works beautifully under sunscreen. If using vitamin C, you could use it every morning or just several mornings per week. Monday, Wednesday, Friday, for example. Apply it after cleansing, before moisturizer and sunscreen. This regular pattern is easy to remember and provides consistent antioxidant benefits. Now let's talk about adjusting your weekly plan based on your skin's feedback. Your weekly plan should be flexible, not rigid. If on Wednesday your skin feels irritated or sensitive, skip that evening's retinoid and just do your basic routine. If your skin is looking particularly congested on Thursday, you might add an extra gentle cleanse or use a clay mask that evening, even if it wasn't scheduled. The plan provides structure, but your skin's current state always takes precedence. Learn to read your skin's signals and adjust accordingly. If you notice your skin becoming irritated despite following your plan, you're probably using actives too frequently or they're too strong. Scale back. If your skin is thriving but you're curious about increasing active use, add one more application per week and observe carefully for a month before increasing further. Seasonal adjustments to your weekly plan are wise. In winter, you might reduce active treatments and increase hydration and protection. In summer, you might tolerate actives better, but need lighter moisturizers and more diligent sun protection. Hormonal fluctuations might also influence your plan. Many people find their skin more sensitive during certain times of their menstrual cycle and might skip actives during those days or need extra soothing care. Let's address how to build a plan when you're just starting your skincare journey. If you're new to skincare, start with just the basics for at least a month. Gentle cleansing, good moisturizer, daily sunscreen, no actives, no treatments, just simple foundational care. This allows you to establish consistency and understand how your skin behaves with basic care alone. After a month of consistent basics, if you want to address a specific concern, add one treatment, just one, using it once or twice weekly. Give this at least another month before adding anything else. This slow, methodical approach prevents overwhelm, allows you to identify what actually helps, and minimizes risk of irritation. Building a sustainable routine slowly is far better than jumping into an elaborate plan that you'll abandon after a few weeks because it's too complicated or causing problems. Let's talk about time management within your weekly plan. Your daily basics should take no more than 5 to 10 minutes morning and evening. If it takes longer, your routine is probably too complicated. Simplify. On evenings with treatments, you might add 5 minutes for application and absorption. On spa nights with masks, you might spend 30 minutes total. But most of your week should involve just those quick, simple basics. Efficiency doesn't mean rushing. You can be efficient and mindful simultaneously. Take your cleansing minute to breathe and be present. Apply products with gentle intention rather than hurried slapping. This transforms your routine into a brief meditation rather than a chore. Consider how your weekly plan fits with your life rhythm. If you're exhausted every Monday, don't schedule treatments Monday evening. Keep it simple. If weekends are when you have more time and energy, that's when to schedule masks or more elaborate care. Your weekly plan should enhance your life, not burden it. It should feel sustainable and appropriate for your actual lifestyle, not some idealized version of life you don't live. Let's address tracking and adjusting your plan over time. Some people benefit from writing out their weekly plan and checking off completed days. This can help with accountability and consistency. Others find this too rigid and prefer a more intuitive approach with general guidelines rather than strict schedules. Take periodic photos of your skin, perhaps monthly, to track progress. When you see your skin every day, gradual improvements can be hard to notice. Photos provide objective evidence of whether your weekly plan is working. If after 2 or 3 months you're not seeing the improvements you hoped for, reassess. Perhaps you need to adjust active frequency, switch products, or address